Incontinence.
Yes.
Hey, 8:20 in the morning, and it is time to ask the doctor today. Our doctor with us is Dr. Brian Stone. He's from Walker Baptist Medical Center, so coming to us from Walker County.
Yes.
It's good to see you.
Good to see you.
So you live here, but you lived in, what, New York for 30 years?
Yes, I did. I was an assistant professor at Columbia University.
How about that?
I decided to come home.
And you're happy to be back here and
Yeah, absolutely.
helping the people up in Walker County. So today we're talking about overactive bladder, kidney stones, something a lot of people deal with. Let's just address kidney stones before we go to our first caller. How prevalent is that problem?
Very prevalent. From South Carolina down to Texas, this is considered the stone belt in
Why
the
is
United
that?
States. Wow, it's a lot of different reasons.
Is it a diet thing?
Maybe more arid climate.
Really?
Dominican Republic, the Middle East, they're hot spots for kidney stones.
Well, that's interesting. I never heard it talk about the environment that way. All right, let's go to Kathy. Kathy has a question. She's in Pinson. Kathy, good morning.
Good morning.
What's your question?
Is it normal to have more incontinence after you have a kidney or bladder infection?
Any condition that irritates the bladder will cause symptoms of overactive bladder, where you get uncontrolled bladder contractions. So during a kidney infection, when the bladder is inflamed, you can get extreme urgency and inability to stop yourself from urinating.
But can it happen for a period, like it's been cleared up for like 2 months and I'm still having the problem?
You need to have yourself evaluated if it's still happening. And then there are a lot of reasons why you may have incontinence and overactive bladder. So there's some things that you would need to rule out to help figure out what the cause is.
All right.
Thank you.
Kathy,
You're quite
thank you, honey. Let's go to Charlene. She's our next caller. She's in Birmingham. Hey, Charlene, good morning.
Good morning.
What's your question?
I've had the surgery, the bladder sling replacement, bladder sling done, and I've been reevaluated, but the problem of incontinence still is reoccurring.
Okay. One of the problems with having the sling is that the amount of tension on the sling not be too tight. And if you've been overcorrected, you can create a situation of obstruction, which can result in symptoms of overactive bladder, where you get the urge, you can't stop it, you have an urge incontinence. And if you're having stress incontinence, where if you cough, sneeze, or strain, you leak, that could be that the sling was not made tight enough. So you would need urodynamic testing, which is a way we evaluate bladder function to help figure out the exact cause, and then the corrections can be made. So I just advise you to follow up with a urologist who's experienced in managing bladder function problems.
All right.
Okay, thank you so much.
Thank you, hon. Let's go to Linda. Linda is in Jasper, and I think she has a question similar to that. Go ahead. Hey, Linda.
Hey.
Hey, what's your question?
Good morning.
Well, I've had stress continence for years, and I want to know if there's anything or any procedure or anything that might help that.
Oh, absolutely. There are a lot of treatments, but the first thing you have to do is be evaluated with the bladder function test that we call urodynamics, and then we can make an assessment of the cause, and then based on that, we can come up with a good treatment for you.
So stress incontinence, the sneezing, coughing,
yes.
Is that what that means by stress?
Stress,
okay.
Yeah, that's totally different from urge incontinence.
Okay.
So sure, there's some great treatments available. You just need to be evaluated.
All right, hon.
All right.
Thank you. Patricia's in Gadsden this morning. She has a question for us. Hey, Patricia, good morning.
Good morning.
What's your question?
Yes, I'm in the nursing home and I'm in a wheelchair all day.
Yes.
Aww.
And as soon as I never urinate while I'm in the wheelchair all day. But when I get into bed at night, that's when I start urinating.
Okay. We call that enuresis, which is a loss of urine while sleeping. I'm assuming you'll be asleep and you just wake up and you're wet?
Yes, well, I know, before I go to sleep, I know that I'm urinating.
Mm-hmm.
And then at night I'm urinating, and yes, I'm wet in the morning when I wake up.
Some of that may be what we call functional incontinence, which is because of your limited mobility, you're having trouble making it to the bathroom in time, and that can kind of coexist with overactive bladder syndrome. So again, need to see a urologist, get yourself evaluated, and there's some ways that we may be able to help you.
Patricia, do you have a doctor available that you can make an appointment and see what's going on there at the nursing home?
Yeah.
Okay.
Yeah, don't let it go. Have yourself checked.
Yeah, all right, honey. I hope I just let them know you need to make an appointment with a urologist, you
Yes.
said?
Yes.
Okay. All right. Thank you, hon.
All right. Thank you.
Okay, bye-bye.
Okay, you're welcome.
All right. Thank you all for calling in. That's our lines are closed now. Thank you. Good to see you.
Oh, good to see you.
Thanks
My
for
pleasure.
coming to see us.
Thank you.
Dr. Brian Stone, Walker Baptist Medical Center. Now here's Jack.